Hi, this is Dr. Giuseppe Marinacci of Biohealth Holistic Dentistry. So if you have a root canal tooth which is infected and needs to be removed, how can you replace it? So we have usually 5 options. The last one is my favorite one and is the one I chose for myself, for my wife, and for my mom. So the first option is to keep a gap. Obviously, it's not the best option, okay? Because obviously we need to have an even bite to bite on both sides. Otherwise, we can affect our joints, we can affect our muscles, the whole posture can be affected. But not only, okay, because each tooth is connected to the brain through our trigeminal nerve system. And in the long term, it could cause some issues, okay, even neurological issues. And science is showing that more and more. Second option, you can have a removable denture. Removable denture means a small tooth that can be placed and can be removed anytime you need to brush your teeth. Okay, obviously this is an option, better than nothing, but it's not a very good option. Okay, especially if you are a young patient. Okay, and most patients, they don't really tolerate a removable denture because it's not completely stable. In the long term, the bone underneath will shrink, and then you need to reline that denture to compensate the bone loss. Otherwise, that denture will be more and more loose, okay? And it's obviously plastic. The third option is a bridge. What is a bridge? So a bridge is basically 3 joint crowns to replace just one missing tooth. So the dentist usually grinds the neighboring teeth, okay, the 2 teeth facing the gap, to make them smaller, and at the end they fit 3 joint teeth, 3 joint crowns to replace just one single tooth. This is not a very conservative option because you have to drill and grind down the neighboring, possibly healthy teeth when it's not really needed, okay? So in this case, with a bridge, you will be able to chew. It's a fixed solution, but obviously it's a little bit aggressive because you have to work on the neighboring teeth when it's not properly needed, okay? At the same time, you cannot floss in between your teeth, and cleaning around the bridge and under the bridge is not very easy for most patients. Also, the average lifespan of a bridge is about 12 years, okay? There is another drawback about bridges. So if you have a problem on one of the 2 teeth supporting the bridge, the whole bridge needs to be sacrificed. The fourth option is titanium implants. Okay, a titanium implant is basically an artificial root that you place into the bone to replace your own root, and on top of it you can have a crown, okay, a tooth to chew on. This solution is good because obviously you don't need to touch the neighboring teeth, but titanium is metal, and we know that metals they can corrode once you insert them into the human body, okay? Obviously, the jawbone is not dry. The jawbone is wet, okay? We have 70% of water inside our jawbones, okay? And placing a titanium screw into the bone, basically, it causes corrosion and metal release into the surrounding tissues, which is not ideal, okay? So the last option, my favorite option, is ceramic implants. So basically, this is the best option because it's fixed, it's metal-free, it's biocompatible, you don't need to touch the neighboring teeth, it's not removable, it's basically long-lasting, okay? And ceramic implants, in particular zirconia implants, nowadays are definitely the best solution from all points of view. So if you don't know how to replace your missing teeth, or if you need to remove a root canal tooth, now you know which options you have.